So before I get into the specific results of our survey, which is why we've come together this afternoon to talk about the Sunshine Coast perspective on help-seeking behaviours and stigma, I thought it would be quite important to actually set the scene on what mental illness and mental health looks like on the Sunshine Coast from a population level. It's really, really valuable that we have people like Dan involved in the conversation who've lived through this. But Dan is one of, unfortunately, many people who are living with this in the area. So nearly 13,000 people on the Sunshine Coast were seen by the hospital and health services for mental health concerns in 2016 to 2017. That's 13,000 lives. Approximately one person per week dies by suicide on the Sunshine Coast. And again, that's a life per week. For every death by suicide, we know that between 100 and 120 people are directly impacted by that loss. So one death, but 100 people impacted. We also know that 86% of the people who died by suicide on the coast had a comorbidity with mental health concerns such as depression, anxiety, and substance abuse, as well as stress disorders. That's a very high statistic, but it's a very motivating one. That's 86% of people who had signs of struggles before their death. That's a lot of opportunity for intervention. That's a lot of what we'll be talking about today, the intervention. How can we build a meaningful and robust intervention to help people before they get to crisis point? So hopefully a lot of you already have heard about the Alliance for Suicide Prevention for the Sunshine Coast, but I'll tell you briefly a bit more about it. It's an evidence-based model that's been trialled in over 50 different countries, and it's been shown to reduce the suicide rates by up to 24% in a 2-year period. Having an evidence-based model is a very, very strong thing, because we can actually say and learn from other people who have applied this model and say that it works. We wanted it to be coast-specific. So it is a model, it is a framework, and we've implemented that, but instead of coming along and telling people on the coast about their issues and what they should do about it, we've been meeting with people and collaborating with different organisations and groups to make sure that this model is coast-specific, that we're identifying the issues that are most important for our community, and that we're developing the activities and the interventions that are going to be meaningful. So it speaks to the collaboration. This right here speaks to our collaboration as well. We're transparent. The Alliance is very transparent and open about everything that we're doing because we need the community to have that ownership of this intervention. In a perfect world, we'll step to the side and this Alliance will thrive by itself because it has that ownership within the community. It's a synchronised focus. So it's not just a one-size-fits-all, one-stop shop. There is absolutely no one answer to addressing something as complex as suicidality. The 4 things that we focus on in the Alliance and that have been shown to be able to reduce suicide are general awareness training, gatekeeper training, so upskilling everybody in the community to identify and respond to suicidality, working with our medical professionals to give them the skills to, again, identify mental health issues and provide appropriate supports, and working on improving the support for high-risk groups and their families. The evidence shows that if we look at those 4 things in unison, we actually have a chance to reduce suicide rates and save lives. So moving on to the survey. This survey was very important to the Alliance as one of our first engagement activities, our first research activities with the community, because it speaks to the fact that we need your voices. Again, we're not the ones standing up and saying, this is how we stop suicide. We need to understand what's going on the coast to be able to address those needs. So we're going to go through some of the key findings of the survey. I would just like to point out that time is short and I'm unfortunately not going to be able to go into every detail that we found in the survey. So I'm going to touch on the highlights. We will be publishing the results as well. So if you have nitty-gritty questions about the statistics and complex analyses, I'm more than happy to answer those in 2 to 3 months. But for today, we're going to look at those common themes that we are going to be able to use right now to help inform our intervention. So we asked people just a bit about their general knowledge regarding mental health on the coast. We found that 63% of people on the coast believe that there's a lot of negative stigma around that's stopping people from accessing help. We know this from the literature, so it's important to know that's the same case for the Sunshine Coast as well. Stigma is a very difficult thing to understand, and that's why we asked a bit about that as well. We asked about services on the coast. There are a number of different services on the coast, from your mental health support services to just your general community support groups. But 64% of people said that the quality and the variety on the Sunshine Coast wasn't enough for the needs of the community. So that could either be there's not enough resources, or people don't know about them, or they don't have access to them. So when we're talking about developing an action to address that, that's a very motivating thing that we can do. We can collaborate with people, we can understand what we've got on the coast, and we can communicate it. A little over 50% of people disagreed that people living on the Sunshine Coast had a good awareness about mental health. We do need to improve our general knowledge around common mental health conditions, because we know that they're the precursors to crisis. The more our general population knows about these precursors, about these very common mental illnesses, the more opportunities we have for change. Our last general knowledge statistic is that 20% of people on the Sunshine Coast don't think that there's a high rate of suicide here. 46% were unsure. Unfortunately, on the Sunshine Coast, we do have a higher rate of suicide per 100,000 people than the national average. It is important that we know that that's not common knowledge, because again, it's about creating that network to catch people within the community, to start the conversation. If people don't think it's a problem, they're not going to be motivated to ask difficult questions and connect with people who might be struggling. All of these statistics are opportunities for change, and we'll be using each one of these statistics to inform an activity, to inform a message that we're going to share with the community, and hopefully we'll start to improve that general knowledge. We asked people about help seeking. Who would they talk to if they were worried about their mental health? How confident they are that those people can actually help them? And do they think they have the skills to identify a mental health issue and provide appropriate support? We asked this in a couple of different ways. Firstly, we gave them a very extensive list of who would you talk to. There weren't many surprising answers in regards to who people are talking to. High percentages of people were talking to general practitioners, mental health professionals, friends and colleagues, partners and family members. There was actually no significant difference between males and females, so we're talking to the same kinds of people, which is a really positive thing. Other supports that were identified were things like our online support services, our employee assistance providers. Alternative health plays a significant role as well. 10% of people on the Sunshine Coast look to these alternative health providers for mental health support. And community support groups play a role as well. This really highlights the fact that any intervention, any suicide prevention program, does have to be multifaceted. The onus doesn't all lie on the general practitioners. It doesn't all lie on our mental health professionals. Everybody has an active role to play in suicide prevention. To talk about the difference between age groups, I am going to focus a little bit on our youth and our middle adults, because they are known to have a higher rate of suicide in the community. So youth are our 16 to 29-year-olds, and our middle adults are our 40 to 60-year-olds. Unfortunately, our 40 to 60-year-olds on the Sunshine Coast have had the highest rate of suicide for the last 10 years. So understanding what's going on with that age group is a very important thing to do. Family members were actually the most frequently identified people that youth would talk to about their mental health concerns, followed by mental health professionals, friends or colleagues, their partners, and doctors down there with 42% of people saying that they would talk to them. Interestingly, there wasn't actually a whole lot of difference between the kinds of people that our middle adults would talk to. The key difference being that inverse of the family members and the doctors. Doctors became the most prominent person that a middle adult would talk to, and a family member coming in there at fifth. This again highlights that multifaceted nature and the need to engage different people, but also in regards to the specific skills that family members might need. How to talk to their kids or their nieces and nephews, or their students if they're teachers, about mental health issues. Unfortunately, we might not know that we need the skills to have a difficult conversation until somebody is asking us or presenting to us having struggles. You might not know that you need those skills until somebody is sitting in front of you reaching out. Concerningly, 5% of youth did say that they would talk to nobody, that it was nobody else's business, their mental health. And 4% of middle adults said the same thing. That might be a very small number, but it's a concerning number. We know that talking about mental health is one of the first places to start when it comes to identifying the problem more and being able to help. So if we have 5% of our youth who aren't talking to anybody, that's a problem that we need to understand. We also asked people how likely they were to talk to specific groups. So we actually presented them with doctors, their social support, so friends, families and colleagues, hotlines or mental health professionals, and asked people how likely they were to talk to those people. 76% said that they were likely to talk to a doctor. That's a really positive number. The majority are saying that they would talk to a doctor. But nearly 30% of people said that they were unsure or unlikely. So again, we've got the majority who are identifying that they would talk to a medical professional. But again, there is a small percentage, but a significant percentage, who aren't talking to anybody. When we look at the difference between males and females, 25% of men said that they were unlikely to talk to a doctor, mental health professional, friend or family, or a hotline. That's 25% of men who, again, aren't talking to anybody. We know that males have a higher rate of suicide than females, and this could be one of the reasons why. If they're not talking to these people, who are they talking to? It's one of the tricky things that we know about mental illness, is that when people start to struggle, they might not be the first people to reach out about those issues. So it is actually on the community to be able to understand that there is a high rate of mental illness on the Sunshine Coast, but also how to be able to identify those risk factors and how to ask the questions around those concerns to make somebody feel supported and safe to talk about their mental health. Our mental health support, our crisis hotlines, were actually some of the least popular services that people access. And I want to draw your attention to this because our hotline and crisis support lines are 24/7. They're trained counsellors on the other end of those phones, and they're there any time of day to talk to people. But if people aren't identifying that this is a support that they would use, we need to identify that and understand that a little bit more, because crisis can hit at any time of day. At 3 a.m. when your doctor isn't open or you don't have your psychologist's phone number. These hotlines literally save lives. So we need to identify what might be stopping people from using these services and work with those services to improve their publicity or their approachability, or whatever it is that barrier. We asked about confidence. So how confident are you that your doctor or your social supports can help you if you are in a mental health crisis? And we asked about confidence because it says a lot about people's behavioural intentions. So I might be able to identify that I would talk to my doctor, but if I'm not actually that confident that they could help me, I might not follow through with that if I was in a state of crisis. So we asked people how confident they were. 26% of people said that they were not confident that a doctor could help them or provide advice about mental health. That's a really concerning number when we consider that our GPs are our first point of call. We do it here basically every day. We tell people, have a chat to your doctor. But if 26% of people aren't confident that their family doctor will help them, they're not likely to follow that advice. 27% of people also said that their doctors don't have the skills, and that might be why they don't have the confidence to go and talk to them. So we found in the survey that 20% of people were unlikely to talk to a medical professional, and this actually might be one of the reasons why. Towards the end of this, I'm going to tell you a bit more about some of the actions that we've already started brewing to address some of these findings. But this is one that's very poignant because we're actually offering a training session tomorrow. When we look at the difference in confidence for friends and family, so our social supports, 50% of people said that they were neutral or not confident about their friend or family's ability to help them. So again, 75% of people said that they'd talk to them, but 50%, half the people said that they weren't confident. So again, if we're talking about planned behaviours and behavioural intention, if we're not confident that these people will help us, how likely are we to be honest and share our experiences? 80% of people said that they were neutral or unsure about their friend or family member's skills to identify a mental health issue and to be able to respond appropriately. So again, really speaking to that skill acquisition and the fact that we might not need to know, we might not know that we need to know these skills until somebody is in front of us asking for help. When we look at the difference between age groups, our youth are more likely to talk to their social supports, which is something that we discussed a bit earlier. So 76% said that they would talk to their social supports, while only 57% identified that they would talk to a doctor. But they're far less confident in the skills of their friends and family than are doctors. So 24% of people said they agreed that their friends and family had the skills to support them, compared to 56% of doctors. So again, these activities, the training that we need to be able to provide to the whole community, it's very, very important because we don't know who needs us until they need us. Middle adults had a very similar trend, so they're just as likely to talk to their social supports as they are to their doctors. But again, that confidence in the skills is quite low. Stigma is something else that we asked about. We used a standardised measure to ask about stigma. We did that for a number of reasons. First and foremost, it gives us some population norms to compare the Sunshine Coast statistics against. So this measure was trialled throughout Australia, so we have population norms of about 7,000 people across the nation. So we can see how the Sunshine Coast is rating compared to the rest of Australia. The scale we used presented 9 different items, and these are commonly held beliefs about depression. And we focused on the depression stigma because it's one of the most frequent precursors to suicidality. Some of the statements, people with depression could snap out of it if they wanted to. Depression is a sign of weakness. It's best to avoid people with depression so you don't become depressed yourself. These are very unhelpful beliefs that unfortunately some people do hold. The scale measured 2 different types of stigma. Personal stigma, so I statements, and perceived stigma, so generally speaking on the Sunshine Coast, people think. In regards to personal stigma, there was actually a lower depression stigma compared to the national norms, overall and by gender, on all items except for depression disclosure. So 20% of males and 21% of females agreed that if they had depression, they wouldn't tell anybody. The national norm on that is about 15 to 17%. If people aren't talking about their mental health, if they're not disclosing it, there's very limited opportunities to intervene and to help. Male responses to statements like people with depression are dangerous and it's best to avoid people with depression so you don't become depressed yourself were as high as national levels. So overall we're doing okay compared to the nation, but our males are still holding some very negative beliefs around depression. These ones are particularly concerning because it really does limit our help offering behaviours. If we're afraid that we'll become depressed ourselves, so we're not talking to our friends who might be displaying signs and symptoms of depression or a mental illness, then again, we're missing opportunities to have that conversation to be able to help. If we look at the difference in demographics, youth actually had the highest level of personal stigma, followed by late middle adults, and early middle adults. I personally found that quite interesting, which actually suggests that I had some kind of stigma around depression on the Sunshine Coast as well. Some of the most frequently agreed statements for youth were depression is a sign of weakness. So that was actually significant, they agreed with that significantly more than the other demographics. Early middle adults, people with depression are unpredictable. If I had depression, I would not tell anybody. A lot of middle adults agreed with that. And late middle adults, there was a high level agreement with, I would not employ somebody if I knew they had depression. I do want to point out that it wasn't the majority who was agreeing with this, but the 10 to 25% of people who were agreeing with this represents a percentage of the population who do need more education around depression and do need more education around mental illness. In regards to perceived stigma, so generally speaking, people on the Sunshine Coast, insert statement here, there was a higher than, the perceived stigma overall was higher than personal stigma, which we know to be quite common because it's easier to project than to accept our own beliefs. But both are important. Even though I might not believe that depression is a sign of personal weakness, if I think that everybody else believes that, how likely am I to ask for help? So it's important to look at both of these types of stigma at the same time. Again, perceived stigma was lower on the Sunshine Coast compared to the national norms. Again, a positive finding. We're moving in the right direction, but there are still some things that we can definitely be tightening up. Male and female responses were again very similar, so they weren't statistically significantly different. The one item that they were significantly different on was most people wouldn't vote for a politician if they knew that they had been depressed. 51% of males agreed with that statement, and 43% of females agreed with that statement. That offers some very interesting questions about perceived roles, perceived power, and things like that. Very interesting discussion starter. The percentage of male agreement on statement, again, that it's best to avoid people so you don't become depressed yourself, was higher than the national norm again. So not only is that a personally held belief, but men on the Sunshine Coast believe that to be generally held as well. So again, if we're looking at how that affects behaviour, if men aren't looking out for their mates and they don't think that their mates are looking out for them, we've got a very unhelpful environment. So it's something that we can definitely be working on. In regards to perceived stigma, there were actually significant differences between the demographics and the level of agreement with these statements. Early middle adults actually had the highest levels of perceived stigma, followed by middle adults, youth, and late middle adults. And again, some of those commonly held beliefs were most people would not vote for a politician if they knew they'd been depressed. Our late middle adults held that there was quite a high level of agreement with that statement. Most people think that depression is not a real medical illness. You think that, generally speaking, people believe that. Most people would not employ somebody if they knew they had depression. The fact that that has come up again in a population that is responsible for a lot of our hiring is quite concerning. And again, that depression is a sign of weakness. That's a stigma that we hold nationally. It's something that we actually have to address as Australians, because it's almost un-Australian that we have a high level of suicide, that we have a high level of not help-seeking behaviour. So if we're seeing that as a sign of weakness, that's a whole paradigm shift that we need to see happen before we can really impact these beliefs that people are holding. So what does this mean? So although depression stigma was lower on the coast compared to the national norms, there's still a lot of work to be done. But what we now know is what some of those common beliefs that are still being held are. So we can work with different demographic groups to be able to understand those beliefs a little bit more, unpack them, and offer education, offer room for improvement. Another finding that the similarities and differences in perspectives between the demographics were quite striking. It gives us insight into the specific kinds of things that we need to address, both within specific age groups, but also across the board. Again, lots of really good opportunities to change. Negative stigma, whether it's our own personal beliefs or what we think everybody else thinks about mental health, can inhibit help offering and help seeking behaviours. It stops us from asking for help. It stops us from stepping up and seeing if people need help. So it is something that we do need to work together on collectively so we can make that improvement. One of my favourite parts of doing this kind of research is, for starters, coming out and telling people about these results, because these are just as important to all of you as they are to the Alliance and our next steps. The translational research that we do here at the Thompson Institute is a point of difference. Everything that we learn from our community, we try and use to develop actions and activities to be able to improve something, to make lives a little bit easier or a little bit better, connect people with services that they need. So I'm going to talk specifically to some of the statistics that I've covered today and what that actually means for the Alliance. So as I mentioned at the top of the presentation, there's 4 focus points that we look at within the Alliance simultaneously. There's gatekeeper training, so that's upskilling the general population to be able to identify risk factors of mental illness and how to have difficult conversations to be able to talk to people more openly about it. Upskilling medical professionals, public awareness and education, and support for high-risk groups. In regards to gatekeeper training, some of the statistics that are most relevant are the findings that we saw in regards to who people are talking to about their mental illness. So we offer gatekeeper training here every month, free of charge for the community. We use a program called Safe Talks, which is an evidence-based training program that is a suicide alertness program. It teaches people the risk factors to suicidality, as well as giving them the opportunity to practice asking the question, are you having thoughts of suicide? In a safe environment that gives people access to state-of-the-art, world-leading knowledge when they need it most. We're also offering this training within the workplace. So to ask people to come down to the Thompson Institute for 4 hours off their own backs is a big ask. So we've been working with organisations across the coast to be able to implement this training within the workplace, to be able to offer it to their staff and clients as part of being associated with that organisation. It is so heartwarming and motivating whenever we meet with the managers and CEOs about how excited they get for this program, because they have a sense of social responsibility, not only to their staff, but to the people that they're seeing every day as well. I have not met with a single person who said, that training is not relevant to me and my business. So we're going to see a lot of this training out in the community, and we rely on each one of you to be able to attend the training or share the training. We rely on our networks within the Alliance to communicate the benefits of these trainings. Upskilling medical professionals. So some of the statistics that really spoke to this were that high percentage of males who wouldn't talk to doctors, and that that our GPs are the most frequently identified mental health supports, but there's still that really low confidence in their skills. So we've been working with our GPs to find a training that would be most appealing to them. So we're talking about a very time-poor population. The program that we've chosen, again, is an evidence-based program that was actually developed by Black Dog Institute, so it's Australian-specific. What this program will teach our doctors is how to undertake a suicide risk assessment, how to develop a collaborative safety plan. So that collaboration part of mental health is still very prominent in what we're working with GPs to teach them. How to provide effective management following a suicide attempt, and how to respond to the needs of people who are bereaved by suicide. So that statistic of for every death, 100 to 120 people are impacted by that loss. Doctors need to be able to have the skills to identify and work with that population as well. We're actually offering our first training right here tomorrow. And we've had a really positive response from the general practitioners and their nursing staff from across the Sunshine Coast about this training. Public awareness and education. So the statistics that were relevant to that were that majority that we saw who believe that there is still that negative stigma on the Sunshine Coast that's stopping people from accessing help. Those commonly held beliefs about people with depression being dangerous, or avoiding people because you might become depressed yourself. And the fact that the majority of people on the coast do think that there's still a very low mental health awareness. We need to work on all of those things. So the public awareness campaign that the Alliance is currently working on is aiming to reduce stigma through awareness, through education, by directing the messages to the demographics that we need to target most. So our first stop is actually our 40 to 60-year-old males. We're working with that population to identify the messages that are most relevant and turn that into learnings that we can communicate by putting that information on billboards and buses and on the boards above the urinals, where people can access this information almost passively. We're also working with our Indigenous population to develop meaningful awareness for the traditional custodians of the land and people who identify as First Nations as well. Because, again, that message needs to be meaningful and relevant to the population. Nothing we're doing alone. All of our public awareness and education is collaborative. We're working with the Sunshine Coast generally, the populations within the Sunshine Coast, the mental health providers and support groups that are already here, as well as other research groups and centres across the world to be able to identify what works and what doesn't. Our last pillar there is support for high-risk groups and their families. I always forget to write that part in there, but it's just as important as working with the support for high-risk groups. So 12% of men said they wouldn't talk to anybody if they were worried about their mental health. 64% of people don't think there is enough quality mental health support on the Sunshine Coast. And 86% of people who died by Sunshine Coast had one of these common comorbidities. So working on the support for high-risk groups, we're actually in the process of developing a digital tool that doesn't just map the resources on the coast, but also offers the capacity to type in where you are, who you are, and what you need to tailor the information to the individual. It's a way of creating an at-your-fingertips directory of not just mental health support specifically, but also community support groups and other alternative providers that might be able to provide some support. We're also developing advisory groups with different populations as well. So we've just started our advisory group with our Indigenous population, which is led by Tegan Schaaf, who works here at the Thompson Institute. And that's been a really positive engagement because, again, we're getting that voice of the community that we need to be able to develop something meaningful. We also offer, we're also running a number of clinical trials from the Thompson Institute as well. I don't think it's commonly known, but your antidepressants, which is what you'll probably get if you go to the emergency room following a suicide attempt, they actually don't take effect for 4 to 6 weeks. We're talking about people who are in crisis and they're being given a prescription for something that's not going to work for 4 to 6 weeks. So we've identified that as a very big limitation in our care, and we're working on some clinical trials to be able to address that need. The preliminary findings of those trials have been absolutely astounding, and we look forward to running another information session in the future to communicate those findings with people as well. I don't think it would be surprising to anybody if I said that the Alliance for Suicide Prevention is busy. It is a complex program. How it works is through community engagement. It's a community-based model. We've been given the framework from researchers, but we need to be able to build in the voice of the people to make sure that it's meaningful and relevant to the Sunshine Coast. We're partnering with a number of different organisations, not just mental health specific ones, but also organisations like Jets Gyms and UE Insurance and Comlink. We need that variety and breadth of partners to be able to understand the nuances of different people's problems or different people's experiences from across the Sunshine Coast, not just the people who are accessing support, because we've seen that a number of people won't actually be accessing formal supports. So how do we understand the whole picture and work with businesses and organisations to develop those partnerships so we can put information and resources and help all over the coast? And I spoke to sustainability a bit earlier. We're working with the community to build something for the community. We want this thing to grow and flourish organically, and that does rely a lot on the buy-in of people exactly like yourselves. So there's a number of different ways to get involved. You've chosen one of those options by coming here this afternoon, which again I'm so grateful for, and on behalf of the team I thank you from the bottom of our hearts that you're showing this motivation and engagement with the Alliance. You can join the Alliance. I can talk to your employers and your organisations about coming on board as partners. There's no strings attached, no fees attached. The base level really is just mutual advocacy, standing up as a community and saying, we have a problem, let's work together to fix it. You can attend training sessions and encourage the people around you to attend training sessions. So as I mentioned, every month we run the gatekeeper training here at the Thompson Institute. We might not know that we need the skills. So coming along to those trainings, even if you don't have somebody that you're particularly concerned in mind, can save a life. Encouraging your friends and families to come along can save a life. Promote awareness on depression and suicide. Be brave enough to step up and start a conversation. Take some of the things that you've learnt here today and talk to your friends and family about them to see what their opinions are. Why do they think that generally on the Sunshine Coast we've got a negative stigma around depression? Start the conversation and speak about it openly. Follow us on Facebook. We like to share a lot of information with our community, and Facebook is a fantastic tool to do that. So follow and share what we post on Facebook to help us increase our spread, because mental health is everybody's responsibility. They might not know about the Thompson Institute and the Alliance for Suicide Prevention, but you might share something that somebody might read, and again, it could go to a place where you could help someone. And also subscribing to our monthly updates. If you don't have Facebook, we have a newsletter that we produce every month. There's a list out on the blue table there if you'd like to write down your details, or you can jump on our website, which is thealliance.org.au, and register your interest there. All of our details are down the bottom there, including our email address. We love getting emails, we love answering questions, we love meeting with people and addressing concerns. Again, we're very transparent about what we do here, which is why I'm here standing in front of you today. So we encourage you to engage with us to help us build this alliance so we can work together as a community to really reduce suicide on the coast. Thank you.